think he might need a bit more liquid.
Cooking at home is one way Jyoti Parmar can control what her kids eat. They have severe food allergies. When they were babies, doctors gave her advice to try to prevent that from happening.
We were told to avoid all the common allergens until they were 2 or 3 years old.
But years later, the Canadian Paediatric Association is urging parents to do the exact opposite and start feeding their babies food like peanut butter or eggs when they're between 4 and 6 months old, even if they have a sibling with a food allergy.
The goal really of this practice point is to give the best evidence that we have to families, in particular families of children at higher risk, to allow them to live the best chance of an allergy-free life.
So what's changed in the years since Jyoti Parmar's kids were born and now? In short, better understanding of the science of food allergies. Back in 2015, a UK study that followed more than 600 children found an 80% reduction in the risk of developing an allergy among those who were exposed to peanuts as babies compared to those who weren't.
We thought that you became allergic through your gut. So the thought at the time was, stay away from these foods, let the gut mature. The big change in our specialty has been, we now think you become allergic through your skin. And so the theory now is, if you eat these foods, your gut's actually teaching your body not to react.
But such an about-face in thinking can take time for family doctors and pediatricians to adopt and pass along to their patients.
I think there are parents out there that are confused in terms of some of the recommendations based on what they've heard from their primary care physician.
The Canadian Paediatric Society hopes to clear up that confusion with this advice. Introduce your baby to foods such as nuts or eggs after they've started eating other solid foods. If there are signs of an allergic reaction, such as a rash, see a doctor. If there's no allergic reaction, keep giving your baby those foods regularly so they maintain a tolerance. And there is an exception. If babies have serious eczema, get medical advice before introducing them to potential allergens. If the current knowledge had existed a decade ago, Jyoti Parmar would have given her babies nuts and other foods.
If I, could actually turn back time, I wish I could.
To try to prevent the allergies they suffer from now.
Thank you very much.
Nicole, Ireland, CBC News, Toronto.